EMS began its community paramedicine program in February of last year, partially reliant on federal funds given to Maine EMS. Waterville EMS says those grants have now been paused. Members of the fire department and EMS take extra shifts and go into the homes of patients after getting referrals from hospitals. They provide anything from medical assistance to picking up needed medications. While the community paramedics are currently part-time, they were intending on adding a full-time position before the funding freeze.
The reason why we want to try to push it full-time moving forward is again, like that continuity of care, having one provider going out and doing these visits, getting to know these people that we're visiting out in the community, establishing the relationships that I have since, starting this, but I need somebody to take it over. I need somebody full-time to do it. We've already made a meaningful impact in the city with this program. It would be really tough to lose it at this point.
Waterville EMS says they are going to continue the program part-time with the funds they do have and are still hoping the federal grants will be unfrozen. They mentioned the program is needed more than ever with Inland Hospital closing in June.